Good day sir, we are from Group 4 and for this video, we're going to explain about the pregnancy and labor. A full-term pregnancy lasts approximately 270 days or about 38 and a half weeks from conception to birth. Because it is easier to remember the first day of the last menstrual period or LMP than to estimate the date of conception, obstetricians set the due date as 284 days or 40 and a half weeks from the LMP. This assumes that conception occurred on day 14 of the woman's cycle, which is usually a good approximation. The 40 weeks of an average pregnancy are usually discussed in terms of 3 trimesters, each approximately 13 weeks. During the second and third trimester, the pregnancy uterus about the size of a fist grows dramatically to contain the fetus, causing a number of anatomical changes in the mother. So ito na yung mga sinasabi natin, mayroong mga nangyayaring pagbabago or anatomical changes sa mother because of pregnancy. And isa na rito yung increasing heart rate and breathing ng mother. A full-term pregnancy lasts approximately 270 days.
Now, we're going to discuss the effects of hormones. During pregnancy, there are 3 hormones involved. First is chorionic gonadotropin or HCG. During the first trimester, the trophoblast cells of the blastocyst will secrete HCG, which then stimulates the corpus luteum in the ovary to secrete estrogens and progesterone. But why does only during the first trimester HCG stimulate the corpus luteum? It is because at this period, the placenta is not yet fully developed. So, this is what's maintaining the pregnancy before we have the placenta. At the end of the first trimester, the trophoblast cells will completely develop into a placenta. So, no more secretion of HCG causes the corpus luteum to degenerate during weeks 12 to 17. And once the placenta is fully developed, the placenta will take over the role to secrete estrogens and progesterone. The second hormone is progesterone. The roles of progesterone is to maintain the endometrium thickness after the placenta is fully developed, which is in the second and third trimester of pregnancy, and also to stimulate breast growth which will be facilitated by the estrogen hormone. The third hormone is estrogen. The roles of estrogen is to support the enlargement of the uterus. So, it causes the uterus to get bigger. We need that because the baby is gonna get bigger. So, the uterus also needs to get bigger and to maintain the endometrium thickness. Also, with progesterone, it will help stimulate breast growth and some minor genital enlargement. And there are vascular changes, which are actually really important because as your uterus gets bigger, it needs a bigger blood supply. So we need some vascular changes to get more blood to that growing uterus.
The placenta converts weak androgens secreted by the maternal and fetal adrenal glands to estrogens, which are necessary for pregnancy to progress. Estrogen level climbed throughout the pregnancy, increasing 30-fold by childbirth. Estrogens have the following actions. First, they suppress FSH and LH or luteinizing hormone production, which is effectively preventing ovulation. Take in mind that this function is the biological basis of hormonal birth control pills. It also induces the growth of fetal tissues and are necessary for the maturation of the fetal lungs and liver. So, nangyayari dito is yung placenta, kino-convert niya yung weak androgens ng mother into estrogen, which help the production of follicle stimulating hormone na importante para sa success maturation of the fetus.
Then we have relaxin, another hormone secreted by the corpus luteum and then by placenta. Our pelvis has 4 joints. We have the symphysis pubis, 2 sacroiliac joints, and sacrococcygeal joint. The joints in pregnant women's bodies became incredibly loose and were able to move more as the relaxin hormone enters the body. Their joints and pelvis become much more elastic when the relaxin hormone is released into their bodies. They are able to move and make larger movements, preparing for the baby to navigate the passage. So this is how their body will stretch just enough to give birth to the baby.
The placenta takes over the synthesis and secretion of progesterone throughout pregnancy as the corpus luteum degenerates. Like estrogen, progesterone suppresses FSH and LH. It also inhibits uterine contractions, protecting the fetus from the preterm birth. This hormone decreases in late gestation, allowing uterine contractions to intensify and eventually progress to true labor. The placenta also produces HCG, in addition to promoting survival of the corpus luteum. HCG stimulates the male fetal gonads to secrete testosterone, which is essential for the development of the male reproductive system.
During pregnancy, the anterior pituitary grows and produces more hormones, which results in higher level of thyrotropin. Together with placental hormones, thyrotropin increases thyroid hormone production. The mother's metabolic rate increases as she has more thyroid gland tissue, causing her metabolic rate to increase. And that's the reason why women are so hungry when they're pregnant. And hot flashes, it usually affect the head, neck, and chest. This is the sudden blast of warmth. It can begin in the first 20 weeks or they can occur during all points of pregnancy and typically during the third trimester. Next is the prolactin. It promotes the growth of a certain type of a breast tissue called mammary alveoli, which are the components of the mammary gland where the production of milk occurs. Last is the adrenocorticotropic hormone or ACTH. Beginning in the last trimester of pregnancy, there is a high ACTH secretion that may promote the growth of the adrenal cortex and increase the cortisol secretion needed for fetal lung maturation. It will stimulate the adrenal glands to produce glucocorticoids, and as glucocorticoids are normally a stress hormone, they will cause the mother to digest some of her proteins, causing protein catabolism and the release of amino acids into the bloodstream, which can be taken up by the fetus for protein synthesis. There are a lot of skin changes you can expect during pregnancy because the dermis stretches extensively to accommodate the growing uterus, breast tissue, and fat deposits on the thighs and hips. So there is stria gravidarum. They usually show up in the latter half of pregnancy, while the majority will be in the lower abdomen. These are most commonly seen as depressions in the skin on the abdomen, which appear as red or purple marks during pregnancy that fade to a silvery white color in the months after childbirth. There is also chloasma. It is also called mask of pregnancy, and here melanotropin is secreted in greater quantity during pregnancy. Melanin production during pregnancy can cause pigmentation to occur on the face, over the nose, cheeks, and forehead of an expectant mom. That is why it is also known as the mask of pregnancy. And the last is the linea nigra. It appears naturally during pregnancy because the melanocyte stimulating hormone created by the placenta causes melanin to rise during pregnancy. Melanin is responsible for giving your skin its color, and this increases in melanin causes your skin to darken during pregnancy. This same hormone is responsible for causing darker areolas, creating a line of pigment from the umbilicus to the pubis.
Good day everyone, this is John Russell A. Domingo of BSED 2A, and in this portion of presentation, let's gonna talk about the weight gain, or the weight that is gained of a pregnant mother, which usually occurs from second to third trimesters of pregnancy. The second trimester associates from week 13 to week 26, and the third trimester associates from week 27 until the birth of a child. During these trimesters, a pregnant woman starts to feel and notice some changes around her body from maternal anatomy or the structures and functions of female reproductive organs and physiology or the physical body. One of the most obvious signs that we can notice around the body of a pregnant woman is the dramatical enlargement of her abdominal region. The maternal weight gain or the dramatic increase in weight of a pregnant woman during or caused by her pregnancy associates from the list of the contributing factors. The developing fetus, the enlarged uterus caused by the developing fetus, amniotic fluid, which is the yellowish fluid that surrounds the fetus inside the uterus, the placenta or the developing organ that supplies oxygen and nutrients to the fetus, additional breast tissues, which is a preparation for breastfeeding, and increase in blood volume. By the given factors above, we can say that it's not just fat that contributes to the weight of a pregnant woman, but also the development of a fetus and essential organs and changes for the proper process of pregnancy. But in a surprising fact, fat storage accounts an approximately of 2.3 kilograms, which later on acts as reserve for the increase in metabolic demand during the breastfeeding. During the first trimesters, a mother or a pregnant woman doesn't need to consume additional calories to maintain a healthy pregnancy. So basically, during the first trimesters, which start from week 1 to week 12, it is only need a little of calories to support a developing child, and an approximately 0.45 kilogram per month of weight gain is very common. During the second and third trimesters, a mother or a pregnant woman start to increase her appetite, and it is now necessary for her to consume an additional 300 kilograms of 300 calories per day to support the development of a fetus.
Changes in organ system during pregnancy. As the woman's body adapts to pregnancy, characteristic physiologic changes occur. These changes can sometimes prompt symptoms often referred to collectively as the common discomforts of pregnancy. Changes to the digestive and urinary system. The initial few weeks to months of pregnancy are characterized by a frequent nausea and vomiting, which can occasionally be brought by a heightened sensitivity to smell. Even though the nausea may last all day, these symptoms is frequently described as a morning sickness. Increased levels of pregnancy-related hormone, notably circulating estrogen, progesterone, and HCG are thought to be the cause of morning sickness during pregnancy. Having less intestinal peristalsis can also make you feel sick. Usually, nausea pregnancy goes away by a week 12 or so. The posterior pituitary has been increasing the amount of oxytocin it secretes, which is a hormone that triggers labor contraction. The myometrium also expresses additional oxytocin receptors, increasing its sensitivity to this hormone. As the labor progresses, oxytocin starts to trigger stronger and more uncomfortable uterine contraction, which in turn triggers the release of prostaglandins from the fetal membrane through a positive feedback loop. Prostaglandins increase uterine contractile strength similar to oxytocin. Additionally, the fetal pituitary releases oxytocin, which further raises prostaglandins level. Given the significance of oxytocin and prostaglandins to the beginning and the continuation of labor, it is not unexpected that an intravenous drip of pictoxin is used to induce labor when a pregnancy is not moving to labor naturally.
Pregnancy really brings many changes in the woman's body and in her systems. It has many reasons why these sudden changes happen. For instance, during pregnancy, a woman's blood volume increased to 30 to 50% to nourish the growing baby in her womb. Also, her heart pumps more blood each minute, that causing her heart rate or pulse to rise. These are the major changes that contribute to the optimal nourish and development of the baby, and also to protect the mother from the risk of giving birth. Another thing is having the varicose veins or the hemorrhoids. Why is this happen? As the fetus grows, the uterus compress underlying pelvic blood vessels, happening the venous return in the pelvic region and legs, that causing the varicose veins or the hemorrhoids that similarly to the varicose veins. Labor or the parturition is the ending phase of the pregnancy, where one or more babies exit in the internal environment of their mother through the cesarean section or vaginal delivery. As the pregnancy progresses into its final week, several physiological changes occur in response to hormones that trigger the woman's pregnancy labor.
As we have recalled during menstruation, progesterone is responsible for the uterus to inhibit the contraction, which now in pregnancy, progesterone still inhibits the uterine contraction for the first several months. However, during the 7th month, the progesterone levels reach its highest peak or limit, then now began to drop. But the levels of estrogen is still rising in the maternal circulation, which then result of increase in estrogen ratio against the progesterone is the myometrium or the smooth uterine muscle become more sensitive to stimuli that promote the contractions against the uterus, which is still effect further until the progesterone secretion weakens over time. The 8th month of pregnancy associates the rise of fetal cortisol, which result in increased estrogen secretion by placenta, which further weaken the effect of progesterone in the uterine smooth muscle. Over time or during the phenomena, majority of pregnant women in their 8th month of pregnancy starting to feel the negative effect of weakened progesterone level, which result in peristaltic Braxton Hicks contractions, also called as pulse labor. It is a cramp that is comparable to mild cramps of menstruation.
The so-called bloody show, which occurs when a plug of mucus builds up in the cervical canal and blocks the entrance of uterus during pregnancy, is a typical indicator that the labor will be brief. This plug loosens is removed about 1 to 2 days before the start of actual labor, along with a tiny amount of blood. The posterior pituitary has been increasing the amount of oxytocin it secretes, which is a hormone that triggers labor contraction. The myometrium also expresses additional oxytocin receptors, increasing its sensitivity to this hormone. As the labor progresses, oxytocin starts to trigger stronger and more uncomfortable uterine contraction, which in turn triggers the release of prostaglandins from the fetal membrane through a positive feedback loop. Prostaglandins increase uterine contractile strength similar to oxytocin. Additionally, the fetal pituitary releases oxytocin, which further raises prostaglandins level. Given the significance of oxytocin and prostaglandins to the beginning and the continuation of labor, it is not unexpected that an intravenous drip of pitocin is used to induce labor when a pregnancy is not moving to labor naturally.
In this stage of maturation, the stretching of the cervix and myometrium occurs. The myometrial contractions of labor is the result of the increase of myometrial activation and stimulation. This developed through the expression of contractions-associated proteins, including the oxytocin receptor, connexin 43, and the prostaglandins receptors. These contract during the labor to push the baby out. Cervical stretching or cervical ripening is a process that preparing the cervix for labor and delivery. It is a process that softening and opening the cervix. At first, your uterus is closed to hold your baby in your uterus. But during the labor, the cervix dilation or widening occurred that allows your full-term fetus to pass through to your canal. It is usually happen within 48 hours, and this can be slightly painful and uncomfortable due to the attributes of the myometrial hypoxia during the uterine contractions. The sum of these changes initiates the regular contractions, also known as the true labor, which become more powerful and more frequent with time. These are normal procedures that helps to reduce the risk of babies being born over 42 weeks of the pregnancy.